Tēnā koutou, tēnā koutou katoa, ko Louise Signal ahau. It's a very great pleasure to be here with you today to talk to you about our work on Kids Cam. We've got a wonderful team that I work with. It's part of the diet program from the University of Auckland, led by my colleague Cleona Niwuraku, who you'll hear from later this morning, and colleagues from the US and also from Ireland. It's HRC funded, and so an Otago Auckland collaboration. We were very lucky because we got permission from our ethics committee to study the world the children live in. And so what I'm going to do is discuss with you today a part of our findings around the obesogenic world that children live in New Zealand. We were lucky enough to be able to work with 168 randomly selected 12-year-olds from Wellington. They were from Porirua, the Hut and Wellington City, and they wore an automated camera and a GPS device for us for 4 days. We thank them, their parents, their families, and the schools that they went to for their generosity in participating in this research. I have to say, I commend you to do research with children. It is a great pleasure. The cameras are automatic, they hang around the neck, there's an example of one there, and they took a photo every 7 seconds. So practically a video of the things that are in front of the child, of 136 degrees in front of them. We were lucky we had a wonderful work from our biostatistician James Stanley, who was able to help us stratify our sample by gender, ethnicity and socioeconomic status. So we have pretty equal numbers of Māori, Pacific and New Zealand European in the study, low, medium and high decile schools, boys and girls. We got 1.3 million photographs, which I have to say we have looked at. Not me personally, a wonderful team of people. And we got 2.9 million GPS points. And the GPS points are now linked to the photographs. So you can basically see where children go. And as any parent would like to know, it is fascinating to see where your children actually go, not necessarily where they tell you they went. I too want to pick up on Louise's earlier point around the Commission on Ending Childhood Obesity, boldly named, I think, co-chaired, as we all know, here in New Zealand by Sir Peter Gluckman, the Prime Minister's Chief Science Advisor. So we are incredibly well placed to understand the evidence and the arguments that are put forward in this report and on the actions that are necessary in this arena. I want to particularly focus on some key points from the Commission's report, where they argue that what we need is a comprehensive, integrated package of interventions to address childhood obesity. There is no silver bullet. Focusing on children's rights, I think we need to take a rights-based approach. There are treaty rights, there are Indigenous rights there are rights of Indigenous peoples, and there are the rights of children. The United Nations Convention on the Rights of the Child. I think we need to be giving more focus on international law and using that as a lever to make the arguments here so that we do have both rights-based and equitable interventions in this country and globally, and that we should utilise a whole-of-government approach. And Louise again was saying, who's in the room, and it may well be that there's a lot of us from health, but we really need to have in transport, treasury, trade as well. So one of the critical areas that the Commission argues is the need to tackle the obesogenic environment, that wonderful phrase that Boyd and his colleagues came up with. And we need to create healthy food environments, reduce exposure to junk food marketing, and tax sugary drinks. So here we are, the best evidence the government needs to act on. We don't really need to do any more research. We know the answer, let's just do it. Okay, so what did we find? Well, this is the world through the children's lens, if you like. So let's just see what's going on here at home. So you get photographs that show you the most intimate elements of children's lives. We see what they're eating. We see what they're watching on television. What are they watching here? McDonald's, yeah. We see the cupboards. There's a wonderful, if anybody wants to do a PhD, there's a wonderful PhD on cupboards and fridges. What people have in their cupboards and what people have in their fridges. We also see children wearing marketing for junk food. In school, a very important area, Jim was just talking with me before about what would I do as the most important thing if there was one thing, and this is an area where I really think we could clean up our act really quickly. We here see an ad in the classroom. What's the ad for? And what's this? And this is their lunch that they've brought to school. Of course, we have that problem in New Zealand when we bring our own lunch. Can people see any of the food there? Is it food? This is the school food service. What can we see here? Any fruit? Yeah. Well spotted in the back by a shoulder. Yeah. Yeah. It's obviously, really close by where the kids can easily say, oh, I'll have one of those. Yeah. Yeah. And then the outdoor environment, we see sedentary behaviour, of course, and we can see what's going on when they're getting their ride home from school. Coke refreshers, and sometimes they don't refresh their signs. This is in East Porirua. And this is the typical shop front. I think we should clean up our shop fronts. What can you see here? Coke, ice cream, energy drinks, yeah, really interesting. Shops and restaurants, so we can see inside dairies. Christina McKercher, who will be well known to many of you, is working with me, and she is doing her PhD, and her major task at the moment is to count how much junk food there is in a dairy. The answer, of course, is a lot, and not much else. Can you see anything healthy in that picture? Eggs, yeah. Water, yeah.
It's not out of the tap.
Yeah, no, it's not out of the tap, is it? It's bottled and expensive. And of course, sharing our love. I'm loving it. So it's sport. Again, an area that I've been on the media a bit lately, talking about alcohol in sport. I think junk food and sport is the same association we need to cut. But this is playing softball. This is a sponsorship that goes on that I think we should ban. The Powerade Challenge I want you to focus on here. The All Blacks have just linked up last year with Gatorade? Yeah, Gatorade. That's Pepsi, not Coke. So what can we see here in this photo? Kids are drinking Mizone, and I think it might be all Mizone there. But it's a sports drink, basically, like Gatorade, like Powerade. Yeah. So we asked the children what do they think about junk food marketing as a sub-study of our work. We tried to assess their engagement with junk food marketing and their attitudes towards it, or with food marketing actually in general. We talked to 33 of the children from the study, and they were well aware of the ubiquitous nature of junk food marketing in their environment and its success in making them feel hungry. Now remember, they were blinded. They didn't know we were interested in junk food. We were studying their world. We asked them if junk food should be marketed to children, and many agreed that it should not. I reckon it shouldn't, said somebody, because then children would get like diabetes and stuff like that. And we said, if you were Prime Minister for a day, would you change something about unhealthy food marketing to children? And nearly 2/3 of the children agreed they would. Somebody said, I'd like to take off all that false advertising, and I'd like to make it true. And I'd get rid of all the billboards and big signs that everyone's forced to see. These are recommendations from Sir Peter Gluckman. So how do we score then in terms of the Commission's areas that I was focusing on there in terms of healthy food environments? Well, not well at all in terms of schools, outdoor environments, shops and restaurants and sport. And in terms of marketing, the same kind of picture, a very obesogenic environment in the New Zealand context. So what could we do about this to address the obesogenic world of New Zealand children? Well, going back to Gluckman again, a comprehensive, integrated, child rights-based, government-led package of interventions, which our research would suggest should include meaningful school policies, food policies in schools, in recreation venues, and in the outdoor environment. That would require schools and councils to provide a healthy food environment. We should bring back the national administrative guideline for schools to only have healthy food in schools, in my view. I think it would be one of the most important things that we could do. And it's well within the government's mandate to do that. They are in charge of schools. Meaningful government regulation of marketing and real sanctions, including, in my view, replacing junk food sports sponsorship. The Advertising Standards Authority's review is woefully inadequate in my view. It proves once again the failure of self-regulation, and I think it's imperative that we have government regulation of marketing to children in this country. We should buy out our junk food and our alcohol, actually. Sports sponsorship, in my view, the Health Promotion Agency could do that very readily, and I think that their predecessor, the Health Sponsorship Council, bought out tobacco sponsorship in the early 90s. It wouldn't be very difficult to do. We've got plenty of a good practice here already in this country. I think actually we probably need to be radical and move to something like plain packaging of junk food. I don't think we've got the time with the obesity epidemic to take as long as it took tobacco to get to this point. We should learn from what tobacco has learnt. They are just making the win now on plain packaging, but much of the marketing the kids see is actually packaging. And removing signs, obviously a local government issue that I think we could do. Wouldn't it be wonderful if Auckland could be a sign-free city? Wouldn't that be good? You could have so much, no alcohol, no junk food. What else could we have none of here in Auckland? But you could be the first city to have a really clean environment from junk food, and especially because you're the big city in our country. And of course, a sugary drinks tax seems like a no-brainer. We know in the marketing mix, price really matters. It works for tobacco, it works for alcohol. Our work would suggest that this is an area where we should indeed act. Otherwise, we are in danger, as the Commission on Ending Childhood Obesity says. If we don't do this, we'll get a failure to act. We'll have major medical, social and economic consequences of major magnitude. Thank you.
Thanks, Louise. Do we have any questions? Jim?
Louise, thank you. Do you think, given that we haven't been terribly successful at persuading governments to do those things, that we should direct more of our energies towards the community, to try and persuade the community to initiate some of these reactions? Because government's got a bit weary of those of us in public health nagging them to reintroduce the nags.
I do think so. That's an absolutely critical element of politics, of democracy, and we know that governments poll all the time. However, Gerhard would tell us that over 50% of people agree with a sugary drinks tax anyway. And is it about 85-90% of people already agree that we should stop junk food advertising to kids? So
we haven't been trying to activate them into action.
Good point. So they're convinced, but it's not something that they'll change their vote on, maybe.
Robert?
Thank you. Robert Beaglehall is my name. Apologies for not being here this morning. But where I was this morning, Louise, it was relevant to this list. I was visiting an ex-associate minister of health and talking about tobacco control. And his perspective, I don't think he would mind me saying so, is focus on one or two things. To talk about a comprehensive, integrated, child rights-based government-led package, it's not going to go anywhere with this, as we know. So if your priority is a sugary drink tax, maybe that is, focus on that. Forget everything else and get, and as Jim says, get a well-organised campaign. We get lost in desiring too much. And I think the lesson from tobacco is keep focused.
I guess I'm more, I have a sense of urgency that drives that, and I guess I'm really speaking back to Gluckman's point, and I think we do need to keep reiterating that. I do agree with you also that the tactics are important, and I agree that a sugary drinks tax would be one that we, in fact I've done research on that subject, I think we really should have that as a top priority. I'd also go for cleaning up schools.
One more question, Barry?
Yeah, thank you very much. Did you look at, you showed us selected slides of the environment they're in. Did you look at a ratio of unhealthy foods to healthy foods?
Yes, we have done some of that, but at the moment the data is not peer-reviewed, so I chose not to speak to that. But we will have that very shortly.
Thank you very much, Louise.